from Wood TV8. Your questions, expert answers on the coronavirus outbreak.
Hi, everyone. I'm Michelle DeSelms. Well, we know you have a lot of questions about the coronavirus. Many of you have been reaching out with concerns about your health, about your well-being. So we have teamed up with some of our community partners to get these questions answered. From symptoms of the virus to keeping a safe distance to self-care for your mental health. Our experts are here to help. We want to start today with Steve Palega, Chief Nursing Officer with Metro Health, who's been with us during this pandemic. Thanks for all you and, of course, all the staff at Metro Hospital. How are you guys doing today, Steve?
Michelle, we're doing good. We are planning. We are working towards being prepared to deal with the surge. We're hoping that everything we're doing with social distancing can help limit that surge. We know it's coming. There's a lot of stress out there with folks because we're kind of waiting for that surge, but we're ready, and we've been able to learn from what we've seen happen in other countries and other states, and it's really helped us to with our preparedness.
And you say waiting for the surge because we do see in other states that they are right in the middle of it. Metro not quite there yet.
No, we're not. We have closed a lot of our elective procedures, and what we're working on right now is getting people cross-trained to support what we think may be coming. Rounded through the hospital this morning, we've got a lot of open beds right now, more than we typically have. So it's just we have time to prepare, and that's what we're doing right now.
Well, that's great to hear. Okay, so let's get to our viewer questions right now. There's certainly a lot of them. This first one comes from Zach, who asks, if you get COVID-19 but show no symptoms, how long will you be a carrier? We've seen people test positive but show no symptoms. Are they contagious, and for how long?
Sure, that's a good question. There's a lot we still don't know about the virus, and what we do know and what I can speak to is we know that people are most contagious when they're having signs and symptoms, when they're the cough, the sneezing, and a fever. Those are the times where we know that people are most contagious, and that's when it's most important to get socially distanced and try to, again, what things we've talked about before is getting a lot of rest, drinking a lot of fluids, taking care of yourself, but right now, that's what we do know. That's when people are most contagious.
Okay, so this next question has been asked to us a lot of times. A lot of people are wondering, can you get this twice?
No, you cannot. Normal immune system produces antibodies when we're exposed to things. And again, the information that we have right now says that our normal system would protect us from being reinfected with COVID once we've had it.
Okay, so Jason Russo wants to know, is there a blood test that can be done to determine if you've already had coronavirus?
No, there's currently not a blood test. The way that we test right now is it's called a nasal pharyngeal swab that goes into the nose and goes into a medium to be tested. So not a blood test right now.
Okay, well, a follow-up to that then. A lot of people were sick earlier this winter, back in January into February. So now they're wondering if they actually had coronavirus, but they weren't tested. Will we ever really know if we had it?
You know, it's hard to tell how long this has been in our communities, and I think I've even said some of the same things with some of our own folks here at the hospital, that maybe this has been in our community a while, but again, we don't really know.
We don't really know, and you talked a little bit earlier about those mild symptoms. A lot of people are having that. They don't need to be going to the hospital right now, is that right? Just taking care at home.
Absolutely correct. The hospitals, again, we're ready, we're prepared. We have some open beds now, but take care of yourselves at home. Try to stay healthy. Try to avoid people that are symptomatic.
Okay, so let's talk about some testing. Who can get a test right now?
So because of the shortage with the tests, we've been prioritizing our tests initially to folks that were in the hospital that were critically ill. And then the next step down is our own employees who are potentially exposed. And there have been some other focus on EMS, firefighters, and some of our first responders. The governor has asked us to set up testing sites. So what people need to do now, if they feel like they need to be tested, they need to call their primary care physician, and their primary care physician will work with, there's a hotline, and the hotline determines if people need to be tested or not, and then it determines which test site they need to be diverted to. We've got a test site up and running.
Okay, well, that's good to know. And then how long until you get results back from that? And then what should people do while they're waiting for those results?
Typically, it's been 5 to 7 days is what we're looking at for people to get results back. And again, all of the things we're talking about with social distancing, good hand washing, cover your cough, try to stay away from folks. The best way to prevent any of this is to prevent getting it. So that's what we need to do beforehand.
All right, Steve Palega, thank you so much for joining us. We really appreciate it. And we will be joined by a doctor from Metro Health when we come right back. Welcome back, everyone. We're answering more of your questions concerning the coronavirus. Dr. Rakesh Pai from Metro is here now with us. Nice to see you again. Really appreciate you taking time to come back today.
Great to see you.
Now, Steve, just a couple of minutes ago was talking about the hospital getting prepared for this potential surge of patients. And I know safety is a concern for patients and also for the staff. So what are you guys doing to prepare for that?
I think the main thing that we've done to help prepare our staff is to use this time out here on the west side to really kind of prepare for what we've been observing on the east side of the state. That's proactively canceling elective surgeries and procedures. That's making sure we're running through various different drills regarding specific types of patients. For example, if a COVID-19 patient is pregnant and needs a C-section, or a COVID-19 patient comes in with a GI bleed or a myocardial infarction, how do we make sure that we're dealing appropriately with all the precautions that we need to take to best treat those patients? I think it's really important for the viewership to know that the vast majority of Americans and Michiganders will not get this disease. They will continue to have their own ailments and problems that they continue to have on a normal weekly or monthly basis, and we still have to be able to provide care for those people in this crisis.
I think, now that you mentioned that, I think we're sort of forgetting that the day-to-day illnesses are going on. People are breaking their legs or, like you say, having appendicitis. Those things are still happening. You're still prepared for that as well.
Yes, that's absolutely right. Those ailments don't stop because of this other crisis. They will continue to happen in the same frequency that they do under normal conditions. And so it's been really important for our physicians. I'm the leader of our physician group here at Metro Health, and it's just very important that we restore normal operations and as normal of care as we're able to deliver right now through telephone visits for these first few days here, and then we're going to have our virtual platform up, and we used to do about 2,250 clinic visits each and every day. Those are partially knocked down because of the pandemic, and we're starting to do these telephone, and soon we'll have video visits online. It's really important that the patients know we're there to take care of them and that we are still available when they need us.
Staying prepared. Okay, so now that the governor has issued that stay-at-home order, a lot of people have questions about staying safe inside their house. Marilyn is asking about cleaning and cleaning supplies. Does alcohol, peroxide, and vinegar work to clean surfaces if that's all you have?
Yeah, so the Centers for Disease Control has put out some recommendations regarding cleaning surfaces. It's very true that the virus can live on surfaces, so it's really important to clean those surfaces. And the CDC states that the first-line agents really should be soap and water. The EPA has listed rubbing alcohol and hydrogen peroxide as suitable alternatives. There really is no evidence that bleach works. Vinegar works. If you're going to use bleach, it's really important to dilute that down and not mix bleach with other cleaners. That can create toxic fumes and potentially become a fire hazard.
Okay, so you mentioned surfaces. A lot of people getting deliveries right now. So what should we do to disinfect things when we get the bags, or if we're still getting packages in the mail, cardboard, things like that?
We believe that the cardboard exposure with respect to the virus remaining on cardboard is low risk. But some people are using gloves to handle cardboard or mail. I think that's a reasonable precaution. It's very important to wipe down those gloves, or if you have a pair of disposable gloves, that might be prudent. I don't know that step's entirely needed, but I have seen some people using that, and I think that's a prudent precaution.
Well, many people are still in the home, but some of us still have that family member coming into the office, going to work. So what should they do? What should we do? Like, once I get home from work today, in terms of disinfecting my clothes, my shoes, things like that?
Yeah, that's another fantastic question. I think it's really important for those people that are essential and are out and about doing their occupations like me. My family's kind of in the home for the most part. The precautions that I take are as soon as I come into the home, I take off my shoes, put them in a very specific area of our house. I immediately go and wash my hands for 20 seconds. That's very, very important. It's not the 10 or 15 seconds. It has to be an extended, prolonged scrubbing of your hands. That's very, very important. And I do that before I touch anyone in my family.
I think this goes back to why so many people are asking if you can get COVID-19 twice, because if someone is sick, they can still stay in their house with their family members once they're recovered, right? Don't have to isolate away from the rest of the family.
That's another really solid question. I will say that, the body's immune system is a very smart system. Once you recognize the virus having been exposed to it, you start to develop antibodies that help you fight the virus. And it's, that can confer some immunity upon people. So we don't believe that you can really get this twice because of that immunity response.
All right, that's good to know. So again, a lot of families at home, but especially on a nice day like today, it's okay to go outside. In fact, that might be encouraged.
Absolutely, but keep that social distance. In my neighborhood, we definitely see people observing that as we're walking on sidewalks. Maintain that minimum distance of at least 6 feet. We believe that's a safe distance so you don't get respiratory droplets or aerosolization on you. So that's really important.
And especially if people are still going to the stores. I heard somebody else say, if you're going to the store, don't be picking things up and looking at the labels at this time. Don't be touching a bunch of things while you're in the store.
Yeah, it's probably prudent at this point in time to minimize contact with the various different products. Or if you're going to do that, again, using gloves or disposable gloves might be a prudent precaution.
All right, good. And wash your hands as always.
Wash your hands, absolutely.
All right, Dr. Pai, thank you so much. Nice to see you again. Appreciate it.
Nice to see you.
When we come back, we are going to turn our focus on our mental health and look at some tools to help during this stressful time. Welcome back. Of course, this is an uncertain time for all of us right now. The coronavirus outbreak is creating a lot of stress, and that can really take a toll on our mental health. Christy Buck, the executive director of the Mental Health Foundation of West Michigan, and of course, the founder of Be Nice, is here to help. Christy, nice to see you, friend.
Good seeing you too.
When we were talking yesterday, it struck me that we both said, how are you doing? How are you doing? We both said, I'm exhausted. So is that the feeling that we're all sort of having right now? Really, it's that it's too much. It's just so overwhelming.
Very much so. And, sometimes things come at me in different ways. And today, a friend sent an article to me and the Harvard Business Journal, and they actually compared grieving to what we're feeling right now. And I found that so compelling, is if you look at that, then now perhaps I can actually manage how I'm feeling right now. And so like grieving, the world has changed right now, and we know it's temporary, but it doesn't feel that way. And we've lost normalcy, we're fear of the economic toll, loss of connecting. And so we all now are collectively grieving. And my husband laughed at me when I was telling this. Yeah, in a way we all are. So like stages of grief, they don't all happen in the same order, but some of us are going through denial. So, gosh, it's not going to affect me, or I'm mad because it's changing my whole lifestyle. It's changing how I'm going to work. My dinner plans, everything about my life is changing. And then there's this bargaining piece. You know what? I'm going to try to just manage this for a couple of weeks. I'm going to keep social distancing, and then everything's going to be okay. But then there's those feelings that I don't know. So then it gets to that grieving point of I got to accept it. All right, so you know what I can do? I can wash my hands, I can keep a safe distance, and then I can learn how to work virtually. And all of a sudden, wow, I'm feeling a little bit better. But for some folks, what can happen is like I'm anticipating the worst that's going to happen. And these are the feelings that are similar to anxiety. So that's where I got to go into understanding mental illness, mental health, and where it's really now affecting bigger things that I think that I'm not in control of and I can't manage.
Well, that's interesting to mention control. So we really should focus on things that we can control. Like you say, we can wash our hands. We can make sure our family stays in the house, those kinds of things.
You got it. And there's so many things that I have to put into play right now. I want people to understand that I should be paying attention to those people and not dismiss those people that can't find control. And that's where I'm going to have to invite myself to reach out and help them to learn from me myself how I'm learning how to manage this. So a lot of it is going to be simple things such as taking breaks, getting outside, making sure that I'm connecting with people, managing my feelings by being in the present. of simple things like breathing and also just really spending time and focusing on the positives of what happened in my day. So when we're struggling with anxiety and possibly feelings of depression, I can't dig in and I can't figure those things out. So this is where I'm encouraging people to invite yourselves to reach out and make sure that you are noticing changes in people's behavior when they can't seem to find and get in control.
This is so important, like you say, to reach out to other people. You know, we talk about how social media and how some of our electronics have really taken us away from other people. This is the time to really kind of lean into that and use it. FaceTime and do the group chats and anything you can, like you say, to reach out to other people.
Wow, this is really a time where suddenly, and I'm actually loving watching people how they are discovering techniques of communicating like Zoom and Skype, even though we've talked about it in the past. Now we're all using it, and these are good tools because what you can do is you can see face-to-face people and see how they're feeling, and I can notice in somebody's face, you know what, they aren't themselves. They seem a little bit more angry. They're distancing themselves. You know, for those of us, like I work on a team and we're very tight knit. We're really close. We see each other every day, and it is different right now not seeing each other. But these Zoom meetings have brought us to be able to be face to face and see how are you feeling, how are you doing. We're starting every meeting out with name something great that happened yesterday and name something that you're going to work on today. And so it's challenging. It's challenging myself to reach out to other people, but also to notice within myself, what do I have to build these resiliency in these difficult times?
You know, this is really a difficult time for teenagers, for kids who don't have that schedule anymore, who don't have that routine. That's really important at this time, just to keep an eye on them and make sure they're keeping an eye on one another.
You know, and there's a lot of, Michelle, some really simplistic things that I can put into play right now too. Take advantage of this time that I have with my family. Take advantage of this time that I can get some exercises and even eat better. I was just saying yesterday, I found myself going to the kitchen much more often. So I've got to learn to substitute something else other than going and trying to eat. So time for meditation and mindfulness and finding purpose and meaning about what is going on right now. It can be difficult, and that's where I tend to be that type of a person. You know what? I'm going to look for the deep meaning here. I am going to look for this, but I've got to share that of how I handle these things with other people that might not be able to do that for themselves. So again, I've got to be noticing and recognizing in friends and family members and neighbors who might not be able to cope with this situation right now, who may be really anxious and depressed. I do want to touch a little bit on right now on depression and suicide, and that is recognizing in people that they're not able to get themselves and pull themselves out of feeling down and feeling blue for 2 weeks or longer. Marked change in somebody's behavior could mean that maybe there's depression. One thing that we have learned, and this is via the Suicide Prevention Coalition that I serve on, we had a Zoom meeting yesterday, and it was amazing. The Zoom meeting just worked again, and we were all together. But there is a concern in the springtime. There is a rise in the number of suicides, and people are compelled to ask, why is this? Well, what happens is in the winter months, we typically know that many of us are sad and many of us can struggle with not being able to get outside, being around people. So here you are, fast forward springtime, and you're thinking, oh, yay, I can get out. But for folks that have been struggling all winter long, this may, in fact, bring that motivation to actually take their life.
Oh, gosh.
They feel better, but they don't feel better psychologically. They feel like, now I can do this. So we need to be very mindful of watching changes in people's behavior. We have to be mindful of people talking about sadness.
Keep an eye out on
I just want to
everybody.
heed those warnings right now too also.
Okay, good. Well, let's issue a quick challenge for everybody to get outside today. It's a gorgeous day. Christy, we will check back in with you tomorrow. Really appreciate you taking time with us today, and of course reaching out to everybody else. Thanks so much. And of course, everybody home, really appreciate you joining us. Keep your questions coming in, woodtv.com or our Facebook page. We'll see you again tomorrow.